everybody. On Positively Tampa Bay today, we are focusing on options, health options, and the tough question of what to do when the insurance company says you're not sick enough to stay in the hospital, but you're not well enough to go home. Joining us to help us sort this out is Cindy Martin, who is the area director of sales for Kindred Healthcare. Thank you for coming in.
Thank you for inviting me.
It's a tough question, so what do I do? Tell our viewers about what happens in the post-acute care.
Post-acute care is any level of healthcare services that are provided to patients and families outside of the acute setting. So when you think about post-acute, there's various levels of it. You have the hospital version, which we call LTAC, and that's what I represent. LTAC stands for Long-Term Acute Care Hospital.
Right.
But there's also skilled nursing facilities. There's rehab facilities.
So you have all these different options and something called transitional care hospitals.
Yes.
What is that?
Yes. So not to confuse you, but a long-term acute care hospital is also a transitional care hospital. We've kind of strayed away from that name, long-term acute, because it's daunting to patients and families to think they're going to be somewhere long-term. And it's not really long-term, it's transitional, because we want them to feel comfortable in their transition to a lower level of care, which is ultimately to get them back home.
Well, we are going to invite our viewers to come on back on Facebook so we can go over it in detail. Thank you for coming in. We're running out of time right now. If for more information, you can visit kindred.com and also 1-866-KINDRED.